Thanks again, Dr. Ferrada, for talking to the Op Report. Tell me about use of trauma ultrasound in the emergency room.
Well, the use of ultrasound in the emergency room is already defined. You said the emergency medicine physicians have done a great job in showing that they can learn this technique and use it regardless of the specialty, and they have already developed it in trauma and point-of-care ultrasound for pleura, cardiovascular, intra-abdominal to look at AAA and AAA rupture, kidney, and also gallbladder. For trauma surgeons, it's of key importance because you're the one who's going to take these patients to the operating room. So you should be the one knowing exactly what are you seeing. If you're seeing blood in the abdomen, yes or no. And now we can expand that tool to evaluate if the patient has pneumothorax, hemothorax, and more importantly, use it as a hemodynamic monitoring tool by visualizing the vena cava and visualizing the heart and seeing how it's contracting, if there's a pericardial effusion, how full or empty is the heart, and in a way, with very little time, get a lot of physiological information, not only focusing on the anatomical information that test will give you.
So you see some use for ultrasound outside of trauma particularly, but in resuscitation of acutely ill surgical patients?
Absolutely. In fact, that's what we do every day. Right now, here in our unit, we not only have trained our residents, interns, medical students, our nurse practitioners, everybody that rotates through our ICU does ultrasound. And we do a lot of echocardiograms. We have about over 4,200 echocardiograms performed by non-cardiologists just to do exactly that. To evaluate for volume status, to evaluate for contractility and causes of hypotension, to see, we have diagnosed several pulmonary emboli through our own limited echocardiogram. And through that, we have been able to diagnose a couple of patients with Takotsubo and then call the cardiologist to help us support those patients that otherwise you have no idea where are they decompensating. And then for the fluid status evaluation, we also use the pleural ultrasound because it can give you additional information about how you're running the resuscitation. So for us, it has been a wonderful tool, not only for physicians, all our attendings do it, but for trainees and for nurse practitioners.
Would you say it's replacing or has replaced the Swan Ganz catheter in your ICU?
I think it will be, knowing that the Swan Ganz catheter has complications as a procedure and increased incidence of pulmonary emboli, you will have to be very selective in the patient that you will use this tool. Still necessary in some cases because what the ultrasound gives you is a visual. You're seeing the heart. How does the heart right side compares to the left side? How is it contracting? Where is the fusion? How is the volume? The Swan Ganz is giving you pressure. So if you're more concerned, and then you're guessing volume through the pressure reading. So if you're more concerned about pulmonary hypertension, then Swan Ganz could be your tool. If you're more concerned and you don't want to have to do the procedure and is a patient, for example, many patients are not intubated, many patients don't even have a central line, you can still do an ultrasound to assess for fluid status. So that is the difference. I think every tool has its use and there's no perfect tool. At the end, they're all operator depending and depending on who interpret that information. So as long as you have a brain and you're thinking in the right thing to do with the patient, I think you can use any tool that you have at your disposition to help the patient in need.
Great. Thanks again, Dr. Ferrada.
Thank you.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.